Hello, my name is Rachel, and I did my project on motivational interviewing in couples therapy. So motivational interviewing began in the 1980s with William Miller and Stephen Rolnick. It was adapted from Carl Rogers' concept of patient-centered therapy. Initially, MI was utilized to help with substance abuse issues and has been quite successful. MI is really effective because it is designed to provide the client with engagement, empathy, respect, dignity, autonomy, control over their own goal-making, and collaboration and support from the therapist. My favorite aspect of MI is that clients make their own goals. Clients tend to be more adherent to goals that they create with their own resources and skill sets in mind. MI has primarily been used for individual therapy, and there are other types of therapy that it could be effective in, such as couples therapy. There's a lot of research available on couple-partnered therapy not using MI. So as an example, I found one study for couple-partnered therapy where both couples were to abstain from alcohol use and go to therapy together. It was found that couples who used we and our language were more successful in attaining their goals than couples that used the singular pronouns. So MI is a successful tool, and supportive couples and therapy yield better results and outcomes. So why not combine both? The two papers that I found on MI and couples therapy, both of them mentioned how effective MI has been with individuals and that MI has been completely overlooked as a tool for couples therapy. It is necessary for MI to be used as a primary tool in couples therapy, not only for the success that we've seen with the individual, but as a template for positive, empathetic, and respectful ways to communicate more effectively. It could also show couples how to work together as a team to solve their own problems. Seeing an example of MI as a communication style can also translate to good communication habits from the couple. So regretfully, there is little literature on MI for couples. There were a few studies discussing MI for families dealing with a family member who had substance abuse issues, and it was called systemic motivational therapy. So I found two really great studies, but only two, using motivational interviewing with couples. So in the first study, they utilized motivational interviewing for gay male couples to discuss the dangers of substance abuse and protection against HIV. It was decided that to use MI because in the literature there has been success using MI with individuals to reduce the risk of HIV with casual partners and reduce the incidence of substance abuse. So they recruited 20 couples, 40 individuals, ages 18 to 29 years old, who received MI for 3 sessions. In the paper, they give examples of a question and answer session from one de-identified couple. And the MI basically went the same way that it does with individual MI, except for the therapist was responding and reinforcing values of each individual person in the couple, even when the couple disagreed on some topics. As far as the data discussion and conclusion in this paper, the researchers decided that the study was an attempt at a theoretical framework for future clinical practice. So essentially what that means is there was not any data analyzed, and they just decided that the study went well and there needs to be more studies like it. Funny enough, 2 years later, the head researcher decided that another paper needed to be put out analyzing the MI fidelity on the 2018 study using the Motivational Interviewing Treatment Integrity Coding Manual, or the MITE. They used 4 coders for the MITE, and they reported that they had great scores for the interviews that were taken in 2018. They reported that the MITE worked well, and the 4 coders had exact agreement on many parameters and nearly exact agreement on other parameters. And here is some of the data that they were most pleased with. So the MITE data was assessed, SPSS version 25, as a two-way mixed effect with high agreement. So the conclusion again was there needs to be more studies using MI with couples, not only because it's an effective therapy tool, but because there needs to be more data out there for evidence-based practice. The limitation of this study was that the initial study was a preliminary investigation of MI therapy, and then the second study was to validate the MI interviewing. This study and the study type needs to be replicated for reliability and consistency. So the second study that I found was conducted in Urmia, Iran, using motivational interviewing on couples discussing the dangers of secondhand smoke on a pregnant wife and a smoking father that are in the same home. This study was performed on 112 couples, each couple dynamic included a non-smoking pregnant wife and a smoking husband. They were divided into two groups, 56 couples each. Both groups were given an identical pre-test at the start of the study, and then the same study as a post-test 4 weeks later. The questions on the test were to determine how often the wife was exposed to secondhand smoke and the duration of exposure reflecting on the week previous. The control group received no intervention, and the intervention group received 90-minute MI sessions twice a week for 4 weeks. The data was collected from the pretest and then 4 weeks later during the post-test. The data were analyzed using a repeated measures of analysis of variance, or ANOVA. The MI intervention group had a significant difference in the duration and frequency of smoke exposure from the baseline data and the control group. So, the MI for couples in this data has significantly reduced the exposure of smoke from the men to the pregnant women. The authors compared this study to another study that used individual MI on just the pregnant woman. When the data from these two studies were compared, the results in this couple MI study reflected more significant results than compared to the individual MI study. The limitations for this study is more research needs to be conducted on a diverse population to show the repeatability and the efficacy of MI with couples. This study in particular was obtained, its participant pool from public health centers in Urmia. Another limitation is that the study is a self-report, and the participants may have some variability in the actual duration of exposure and then compared to their estimated duration. So, implications for practice. For social workers, there needs to be more research on this topic. It is important for us to use evidence-based practice in our work, and unfortunately, there's not a lot of evidence. So, in all of my searches, I found these two studies on MI with couples. For the population, the primary reason is, of course, MI is an effective tool to create positive change. But the secondary reason, as I stated earlier, MI has an empathetic way of respecting and supporting the client. This is a great example of positive communication. It may be difficult for clients to communicate effectively and respectfully if they have not had an example of this in their upbringing. Seeing how the therapist communicates with each individual and respects their agreements and disagreements on topics can also be a good experience and example for clients. So the overall summary is motivational interviewing has been effective for individuals with substance abuse issues. It is time for MI to be more widely utilized in therapy settings. It seems like we have a great tool to use that is often neglected in other modalities.